Hi, everyone, and welcome to another episode of the STEMS Monthly Minute. Each month, we share a short update focused on practical topics that support patient care and strengthen our EMS system across Allegheny, Cattaraugus, and Chautauqua counties. Today's topic is the secondary assessment. While the primary assessment focuses on identifying and treating immediate life threats, the secondary assessment gives you the opportunity to gather a more complete picture of your patient's condition. It can reveal injuries, illnesses, or changes in a patient's condition that aren't immediately obvious and help ensure nothing important is overlooked. Why the secondary assessment matters. The primary assessment answers one important question. Does the patient have an immediate life threat that needs to be addressed right now? Once you identified and manage those priorities, it's time to move on to the secondary assessment. This is your opportunity to perform a more thorough evaluation of the patient. A systematic secondary assessment can uncover additional injuries, identify subtle changes in condition, and provide valuable information that guides treatment and supports a more complete handoff at the hospital. One of the most important things to remember is that the first problem that you find isn't always the only problem the patient has. When should you perform a secondary assessment? The secondary assessment should be performed after you've completed your primary assessment and addressed any immediate life threats. Depending on the patient's condition and the circumstances of the call, this may happen on scene or during transport. For critically ill or injured patients, treatment and transport should never be delayed simply to complete a head-to-toe assessment. Instead, continue your assessment as the patient's condition and situation allows. Remember, patient assessment is an ongoing process. Continue reassessing your patient throughout transport and be alert for any changes in their condition. A systematic approach. A consistent, systematic approach helps ensure you don't overlook important findings. For trauma patients, examine each body region in a logical order using the DCAP BLS tick mnemonic as a reminder of what to look for. D is deformities, C is contusions, A is abrasions and avulsions, P is punctures and penetrations, B is burns, L is lacerations, S is swelling, T is tenderness, I is instability, and C is crepitation. Using this systematic approach helps ensure you don't overlook injuries that may not be immediately obvious. For medical patients, the secondary assessment may be more focused and should be guided by the patient's chief complaint, history, vital signs, and overall presentation. Depending on the patient's condition, this may include a focused assessment of the affected body system or a more complete examination. New York State EMS Collaborative Protocols describe the secondary assessment as either focused or complete, and depending on the patient's presentation and chief complaint. Whether your patient has a traumatic injury or a medical emergency, using a consistent and systematic approach helps reduce the chance of missing important findings. Avoid tunnel vision. It's easy to focus on the patient's most obvious complaint, but doing so can sometimes cause us to miss other significant findings. Imagine responding to a patient who fell and is complaining of severe wrist pain. It's natural to focus on the obvious injury, but during your secondary assessment, you can also discover pelvic tenderness and shortening of one leg, suggesting a potentially significant hip or pelvic injury. This is a reminder that patients often have more than one injury or illness, and a systematic assessment helps ensure you're treating the whole patient, not just the most obvious problem. Document what you find. Your assessment doesn't end when you identify your findings, it also needs to be documented. Record both significant findings and pertinent negatives when appropriate. Document any changes in the patient's condition, repeat assessments, treatments provided, and how the patient responded. Complete documentation not only supports continuity of care, but also creates an accurate record of your clinical decision-making. Common pitfalls. Some common pitfall mistakes include skipping the secondary assessment when time allows, focusing only on the chief complaint, failing to reassess the patient during transport, missing subtle findings because the assessment wasn't systematic, and forgetting to document important assessment findings. Developing a consistent routine can help avoid many of these pitfalls. Takeaways. A secondary assessment should be completed on every patient to the extent their condition and circumstances allow. Remember to complete your primary assessment and address life threats first. Use a consistent, systematic approach. Tailor your assessment to the patient's condition and chief complaint. Continue reassessing throughout patient care, and document your findings clearly and completely. A focused and systematic secondary assessment completed without delaying critical treatment or transport can identify hidden injuries, guide treatment decisions, and improve patient outcomes. As always, providers should follow the New York State EMS collaborative protocols and their agency policies when performing patient assessments. Thank you for everything you do to serve your communities. If there are topics you would like us to cover in future STEMS Monthly Minutes, please reach out. STEMS is always here to support you.